it's Dr. Rebecca Baxt here in Paramus, New Jersey. I'm a board-certified dermatologist, and I want to talk to you about toxins. Botox was the first one that was FDA approved. It was discovered many years ago. We've been using it for decades. Here it is. It works incredibly well. I would say most patients in our office do receive Baxt CosMedical, brand name, because that's just my favorite because I've been using it for so long. But other ones have come along and have been FDA approved and are also great, and we stock those as well for various reasons. Sometimes patients come to us, they've already been on a particular toxin, they want to continue, that's fine. Or sometimes there's one toxin that works better for a patient than another toxin. I usually compare it to sort of Coke and Pepsi. Some people like Coke, some people like Pepsi. They're basically the same thing, slight differences. So the next one that got FDA approved many years ago was Dysport. Dysport also works incredibly well, and we love it. And then Xeomin got FDA approved. Some people call it the naked toxin because there isn't a lot of excess proteins around it. And we use Xeomin for a lot of patients. And then most recently, Daxxify was approved. And while Daxxify was supposed to be a real game changer and last much longer, it turns out it's basically about the same as the rest of the toxins. They all tend to last around 3 to 4 months. There are patients who get a little bit more out of any given toxin. Typically, if they do it over and over and over again consistently, the muscles weaken. They start to forget how to make some of the muscle motions that were causing their wrinkles. And so with consistent use, really any of the toxins can last longer, but we love all of them, and I love performing toxin injections on patients. It's really just a quick, easy way to take some years off of the appearance of the face, and I love doing it. It makes people just look like themselves, just rested and like they took a vacation recently. We don't do it in a manner that makes people look fake. I know there's a lot of people walking around with sort of bizarre looking injections. That's not the way that we do our injections here. It's really an art. And so while you can get Botox really on any street corner these days, at medi-spas, at house parties, sometimes at the gym or the dentist, it's really best to find an expert injector. I'm a board-certified dermatologist. I've been doing this for decades. I love doing it. Happy to see people for consults. We offer no charge consults for Botox or other toxins. So I look forward to seeing you, and if you are not in the area, I would search for an expert injector, preferably a board-certified dermatologist or a plastic surgeon or a facial plastic who does their own injections to get the best results from the toxins.